Hello, everyone. I'm Taylor Lopez, Health Communications Director for the National Minority Quality Forum. June is Alzheimer's and Brain Health Awareness Month, and we're hosting a very critical discussion on Alzheimer's disease, its disproportionate effects on Black and Brown communities, and encouraging our families to open up, really have a heart-to-heart, and talk openly about memory loss and to take early action. So today we're joined by a very powerful panel of experts and advocates. First up, we have Marcia Henn, Alzheimer's and dementia specialist and consultant and longtime educator in this space. Next is Kelly G. Loeb, a social worker and community engagement leader from the University of Kansas Alzheimer's Disease Research Center. Next, Letitia Sweat, volunteer for the Alzheimer's Association and a caregiver who has been walking this journey with her mother. And last but certainly not least, Dr. Sarah Walter, Alzheimer's Clinical Trials Consortium Program Administrator and lead for public and participant involvement at the Alzheimer's Therapeutic Research Institute at the University of Southern California. Thank you all so much for being here. Now, I want to start with a little context. So more than 6 million Americans are living with Alzheimer's today, but not everyone is affected equally. In fact, Black Americans are twice as likely as white Americans to develop Alzheimer's, and Hispanic Americans are about 1.5 times more likely. Now, despite this, people of color are more likely to be diagnosed late, less likely to receive quality care, and far less likely to be included in research that's shaping tomorrow's treatments. And we know that when people face delays in diagnosis, barriers to care, or lack of support, it's not just unfair, but it's really a breakdown in the natural order of how human body works. So that's why we're here. So Marcia, I want to start with you. Can you just help us to understand why Alzheimer's is hitting Black and Brown communities so hard?
Yeah, absolutely. First of all, of course, I want to say good afternoon and thank you to you, Taylor, and to National Minority Quality Forum, and of course, LinkedIn, and all the lovely panel members that are here today to talk about this really important conversation. How is this, as you mentioned, I think the statistics that you just mentioned, Black and Brown between twice as likely and 1.5 times as likely for Latinos than white adults. That's pretty staggering numbers. And not only is this affecting them in those high numbers, it's really also what comes before and after, what lingers on, as a caregiver, as a family member, and what they're having to deal with, lack of support or lack of, competent resources that they may not be even aware of that are out there. I think it's important to know that we're seeing really high rates in like comorbidities or, other chronic illnesses like diabetes, high blood pressure, heart disease, that these are, risks that also contribute to Alzheimer's or symptoms for later on Alzheimer's. And I think that that's as bad as that is, the care is actually less. So it's kind of like this imbalance in those rates continuing to be higher and good, competent care not really being available.
And so thank you for that, Marcia. And we know, Alzheimer's causes the brain to just slowly break down. So I want to ask, how does delayed diagnosis or poor access to care make that worse, especially for people of color?
Especially because people of color and Latinos in general, Black and Brown, are generally being diagnosed at a later stage. So anywhere from middle to late stage. That is naturally a very unfortunate thing. And the reason is because with an early diagnosis, there's so much that we can do, beforehand. Not only in obviously, to have a diagnosis and to understand what is coming down the pike, but really able, time to be able to plan, time to find your support system. And it's not going to only be emotional support, but really understanding really what support looks like. And it's going to be maybe lining up, your medical team understanding that there's also going to be a real strong need for physical care, and who is that going to be? What's our village going to look like? Right. And that's going to be, from family members to friends to neighbors, but it really takes time to really kind of put this all together. And obviously, gathering your legal documents, understanding what type of care you're going to want, and voicing that. And really giving the person with that diagnosis a chance to be able to still, and hopefully for a long time before it progresses or advances, to live independently, to live, with dignity, and to be able to have a really strong say-so in the type of care that they're going to have.
Great. And I want to shift gears just a little bit when it comes to healthcare and the job of healthcare. So in your view, from your perspective, what is the job of healthcare when it comes to Alzheimer's? And how do you think that the healthcare system is falling short in taking care of Alzheimer's patients?
Yeah, that's a really good question. I think that it's important to see that we want to be grateful for all the advances that the medical system and teams have done, and how much we've advanced. But with that, we also unfortunately are looking at how we can see at all the opportunities where we can be a little bit better, right? And I think that, in general, what does healthcare look like? For me, in the ideal world, healthcare really should be about, avoiding any kind of pain, avoiding any kind of suffering, education, and building trust with those families. If something is, if a condition arises, it's really important that everybody has equal and full access to healthcare, right? And not that because somebody, depends on where they live and or what type of inequities there have been, especially in the Black and Brown communities, that might, hinder any type of care that this person, really deserves or needs at that point. That's really tough. Where are we failing? I think we really need to, again, bring a lot of education to the medical system, and making sure that, or demand of that, of them, to really make sure primary care doctors are really trying to give a correct diagnosis, or maybe even just to even backing it up, training them so that they know what to look out for. Many individuals don't necessarily immediately think when there's some kind of memory loss symptoms, oh, let me go to a neurologist or a gerontologist. They're still going to kind of religiously go to their, PCP, their primary care physician. And that physician might not be fully trained in seeing what, dementia symptoms are like, or maybe I think that the stigma is, forgetfulness or repetitiveness. But there's so many other things that we need to be looking out for. So making sure that our, initial doctors, primary care physicians are well trained. That, of course, goes along with, anyone. I mean, we can talk about, police, mental health specialists, others that are not maybe always thinking of dementia, but just making sure that they all have enough kind of training or understanding of what, Alzheimer's and dementia is, especially because it's so prevalent right now. One sees this and the numbers are growing. I am a former caregiver of my mother who had Alzheimer's, and I can tell you I was not in the Alzheimer's space at the time. And along with my sisters and I, we knew about Alzheimer's, but we were oblivious to even seeing the symptoms. Because I think that we come from a culture, I'm Colombian, come from a culture that we don't question our parents. We don't, we really believe that if our parents are telling us something, we're going to trust them and go with that. And so, as an example, if my mom was telling me something, I was convincing my sisters, no, mom said this, so that's law. And, we weren't really looking at, okay, mom wasn't really able to give me the correct answer anymore. She was beyond that. And I didn't know where to find resources. I didn't know that free resources were available, education, support groups, so necessary, and then you get to a point as a caregiver where you really have kind of burnt yourself out. So self-care, but really kind of getting back to, the fact of healthcare and where can we now hope to be and going forward. I think it's really important to hold, these people accountable for the fact that we need to make sure that they have the education, that there's outreach out there for specifically for these underserved communities, and to meet them where they're at. I can't tell you enough that we just have to meet them where they're at. Go to churches, go to senior centers, go to rec centers, go to where people already have built trust, right? And that's in these places of worship, because otherwise, if we're going to wait for them to come to us, it may not happen, and so they may go without a diagnosis.
Yeah, and that trust aspect is so important when doing this community outreach, and we'll get to that a little bit later when we get to Kelly. But I do want to jump to Letitia, who is a caregiver for her mother who's been diagnosed with Alzheimer's. Letitia, thank you so much for being here. I just want to ask first, can you share what your experience has been like caring for your mother who's been diagnosed with Alzheimer's?
Thank you, Taylor. And the same. Thank you for inviting me and allowing me to share my story. The first word that comes to mind is roller coaster. My mother and I, we've been on this journey together since 2016. She was diagnosed late. She had basically passed out in the home while she was caring for her great-grandchildren. And I got the call from my niece that mommy had fallen out in the house, and I'm coordinating an ambulance to take her to the hospital and for me to meet her there. And once I got to the hospital, I knew something was wrong. My mother's always been a very large woman. And so in the hospital, underneath the hospital scrubs, I saw my mother was down to probably 125, a weight of 125. Mommy had been hiding it for a very long time. I thought that I was basically seeing symptoms of or intergenerational things. My mother had not raised children since me. And at the time, I think I was in my late 30s going into my early 40s, and she was raising soon to be 2 teenagers. So what I was seeing, I thought it was, okay, you're in your 80s and you now have these teenagers. And so we have this strife. But now I know that she was exhibiting symptoms, but I didn't know what I was looking at. So after she was released from the hospital, we talked, and I asked her if she would go to get her brain tested, and she agreed. And at that point, I received a positive diagnosis that she had Alzheimer's. And I was basically all over it then. I was familiar with the Alzheimer's Association just from hearing them within the community or seeing the flyers. So they were the first persons who I reached out to, in addition to doing my own research within her hospital system to see if they had some sort of Center for the Aging Brain. And I did find one. And I the appointments myself for her, and I let her PCP know, and we've just been on that journey ever since.
So I imagine, and thank you for sharing that, Letitia. I imagine that you have been, just in and out of doctor's offices, making so many different, appointments with different providers. Were there times when you felt like the healthcare system made things like a little harder instead of like helping you on your journey? And what kind of support would have made a difference in your journey?
Absolutely. As I stated, a lot of the information I found out on my own. I think in my past life, I must have been a detective or a researcher of some sort, because you give me a cause, you give me a topic, I'm all over it. So I think just that in and of itself, in terms of having to look for the information, not every caregiver is going to be, as I am, in terms of, not stopping until I get the question answered or until I find the connection. and asking the questions. So I think just that needle in the haystack in terms of getting the information. And her PCP, wonderful man, he's been treating her for a very long time, and he loves her to death. But however, he didn't have the information himself about the center
Mm-hmm.
in his own hospital system. So that in and of itself made it very difficult. Um, then from there, I would say a lot of my information also I received through friends. Little did I know that my very close friends, they were on this journey and had been on this journey for years, and I didn't know it until I shared my story, what was going on. And from there, they jumped into action, giving me, books and handouts, and telling me what to look out for, UTIs, and just really being my support group and educating me until I can continue to educate myself in, diving into YouTube videos and Tika Snow, anything and everything, just devouring it. So I think what made it very difficult, like I said, just trying to connect those dots. And then also, once you did have an opportunity to connect those dots, trying to get the appointments. Unfortunately, as we know, Alzheimer's is definitely very prevalent, and unfortunately, it's very prevalent. Here in the Bronx, where we're number one, within the whole state of New York. And so because of that, you have to wait a very long time for an appointment, just for that initial appointment, to see that physician 6 months out or so. So I think that made it very difficult, and that makes it very difficult for caregivers, to even get that first diagnosis, in terms of just meeting with someone outside of your PCP.
Right. And I mean, I know this is just an extreme burden to carry. I mean, being a caregiver for anyone with any type of disease, but we're dealing with Alzheimer's. I can't imagine this is just taking some sort of extreme emotional toll on you and your mental health. So, could you just share like what sort of emotional toll or impact that this has had on you and your family?
It's had a huge impact. Me personally, it's caused me to have to shift gears in my career. It's caused me to have deficits, financially. It's cost me some relationships. So it actually affected me and has been affecting me for a very long time in very profound ways. And my story is not isolated. This happens to many caregivers. And as far as my family, it's kind of a catch-22. I've always been the one that's been pretty level-headed in terms of, okay, we have a situation and we need to deal with it, and this is how we're going to deal with it. A lot of my family members, and my sisters, I do have two other sisters, they're partially and have been partially in denial. I think just now they're coming into grips in terms of realizing that, yeah, things are different. Yeah, mommy's not the same. In the beginning, it was, oh, she's just doing this on purpose. I'm like, no, she's not doing this on purpose. She has changes in her brain and have been having changes in her brain. So it does take a lot, out of you. I'm happy to say now, I think I have a better handle on it in terms of being a caregiver, returning back to work, having that balance, navigating, the whole system with having aides and having the amount of aides that I need to care for her and to allow me, to get back to myself, and in some way, shape, or form.
Right. And I'm so glad you have that additional support, in helping take care of your mother. So how are you taking care of yourself, as are working very hard to take care of your mom? How are you taking care of yourself as a caregiver?
That's the $1,000,000 question. And I'll be very honest, I'm still a work in progress on that. I've gotten a lot better. What I have been doing, and it's kind of funny, my way of taking care of myself is actually helping to take care of others. So I've actually joined the Alzheimer's Association, and I volunteer with them. So that's been my piece in terms of taking care of myself, in terms of making sure that I'm out there advocating not only for myself, but other caregivers, advocating and educating, my community, on this disease. As I tell people, I say, you don't know what you're looking for until you know what you're looking for. And when you've met one person with Alzheimer's, you've only met that one person, because every situation is different. Every person with Alzheimer's is different. So it's become my personal mission to really be out there front and center, advocating and educating. And also with that in mind, as it was mentioned before, having that time to prepare. Because many times you are thrusted into this role overnight. There's no preparation. Most families are not having conversations about, wills and power of attorneys and health proxies. And so sometimes when this happens, you have nothing in place. Luckily, my mother and I, we always had conversations. So I knew a lot of what was going on, and we prepared about 10 years prior to her, to 2016. So we had paperwork in order. So when it did happen, I didn't have to, run around and try to get power of attorneys. I had all that. All I just needed to do was just to execute. So if I have to say just any one takeaway in terms of what would be most helpful, to a caregiver, in terms of, connecting to resources, is really giving you that time to prepare. Because once you're in it, it's just, you're really just rocking and rolling on all cylinders, and you really do not have time to think. But I've been very blessed with having great support groups, connecting to wonderful organizations locally, outside of New York. Also, I've had great support systems and support groups. So I consider myself to be very lucky. And as I said, right now, my mother turned 94 on May 12th. So I consider myself the lucky one. She was diagnosed late, but she's still here.
Wonderful. Thank you so much, Letitia, for sharing your story. Honestly, I think that anyone watching this who is experiencing the same thing, that's why it's important that we talk to each other, like really have that heart to heart and talk with each other, because we can learn so much from other people's experience. So thank you so much, Letitia, for sharing that story. I want to shift gears to you, Kelly. Your work focuses on meeting families where they are. So I want to ask, how does community outreach help build trust around Alzheimer's care? We know that, building trust in community is super important, especially when we're addressing, different health needs. But, how does, community outreach really help build that trust around this particular disease?
Well, I'll say, Taylor, that's absolutely something that we need to do better about. We need to work on. We could all take a page out of Letitia's book when she talks about using her village and her community. All of these researchers with all their degrees and all their fancy titles really could take us all back to basics and connect with our communities and look at what we do well for each other. It takes a village. And I'm so impressed by what Letitia said about reaching out to those folks around her, getting what she needed from them and then turning around and giving back is what we need to do in terms of research. I bet anybody watching this, if they heard, I work at an Alzheimer's disease research center, there's usually one of two responses to that. When I tell people, they either come really close to me and they say, oh, my mother and my grandmother and my father and my uncle and everybody I've ever known has had Alzheimer's, or they start backing away very slowly because they think it's catching. And so I think people don't understand what research can do. And I know Sarah is going to give us a lot more information about clinical trials. But in terms of community engagement, I think the onus is on those of us on the research side to understand the communities that we are serving and to recognize that we are serving the community, not expecting the community to serve us. There is a very reasonable, I think, distrust of researchers, especially in Black and Brown communities, because of historical misbehavior. And so we really have kind of a lot of audacity to go out in communities and say, please tell us all of your business so we can cure this disease. When we should say, please tell us all of your business so that we can help you. And so it's going to take people who feel engaged with people who look like them, who can say, yeah, I heard Letitia's story and it rang a bell with me. Speaking on my own role, both of my grandmothers had Alzheimer's disease. And so when I go out to talk about what we're doing in terms of research, I can do that from a place of understanding, of perspective, of saying, yep, been there, done that. I'm still here. I'm still here to tell the story. Unfortunately, my grandmothers are not, but I want to make it so that your grandmother will be here and your grandchildren will be here. And so we have to do that from a place of transparency. We have to do it in terms of saying we've got some empirical evidence, right? Some peer-based evidence that is replicatable. We're not just making things up. Oh, the myths about Alzheimer's, you've all heard them, right? All the things that people think are true about Alzheimer's, we've got to come out and say, here's what we know. Here's what is true. And every time I talk to people about Alzheimer's, I always want them to know Alzheimer's disease is not a normal part of aging. And I think that's part of it. I think people think, well, I'm 94. It's time for me to forget everything I ever knew. And that's not how it works. But people don't know that. And so it's our duty to get out there and tell people true information, useful information, information that makes them feel included and accepted and valued. And that's just the start of us getting on the right track toward building community engagement and trust.
Yeah, and you kind of spoke on this just a little bit, but just in knowing what you know, what do you feel like is working when it comes to educating families, for who are planning for care?
Sure,
what do you think is working?
What I think is a really generous way of giving information is when someone who is prominent for any number of reasons is kind enough to come out, I guess, to borrow another group's phrasing, but to come out and say, yes, I have this diagnosis. I have this diagnosis. Here's what I'm doing to get help. Here's some money I'm going to throw at it so that other people can get help. I think when people are willing to speak up and speak out, especially those people we kind of look up to and admire, we wish they didn't have the diagnosis, but we are grateful that they're willing to share their stories. We've talked in this conversation about how Black people and brown people are more likely to be diagnosed and then kind of ironically, I don't know if that's irony, but to get that diagnosis later, we're more likely to get it, but we don't know about it until later. I mean, that's just kind of a terrible mix-up. But what I was leading up to saying is that we know in our communities that these diagnoses happen more often. But we also know that Alzheimer's disease is a pretty equal opportunity disease. I mean, if we have a brain, we're at risk of having this disease. And so everybody needs to pay attention to brain health. We're not all on this road of one day I'm going to get Alzheimer's. We want to think about, I want to be on a road where there is no Alzheimer's disease. And in order to get there, people have got to be able to tell their stories. And so I think engagement is at its best when people are willing to open their mouths and say, here's what's happening and here's what I'm doing about it. And I need help. It is okay to say, I need help. All those well-meaning people in our lives that come to us and say, oh, if you ever need anything, just let me know. Take them up on it. We've got to be able to say, I need you to go pick up some groceries for me. I need you to go put some gas in my car. I need you to return this phone call for me, so that then we can take our energy and put it toward that loved one. And I loved what you asked Letitia, put her out there on what are you doing to take care of yourself. Letitia, I don't know if you can tell, I'm looking right at you. Self-care for the caregiver is so important. So if we can just get all of these things that all of us have said and do them all the time, then we will be on the right track.
Great. And, we talked about, families needing to talk more openly about Alzheimer's, talking with each other, talking with friends, family, more openly about the disease. But how can we make them talk more openly? How can we help families talk about Alzheimer's more openly, including issues like food and housing and transportation that affect how people can manage this disease?
Oh my goodness, you're warming my social work heart by asking that question, because Alzheimer's disease isn't just about I forgot something, and it is definitely not about, well, I'm a certain age and now it's time for my brain to to not work anymore. Alzheimer's disease is absolutely a change in the way we move about our daily lives. Not only is it about how we remember, but it is about how we move about our day, how we eat, how we dress, how we travel, how we communicate. And when any one of those pieces is disrupted, as they all are in Alzheimer's disease, then this is not just about forgetfulness. Forgetfulness is, maybe the least of it in so many cases. And so that's why when we strengthen our communities to provide good access, better than good, when we provide comprehensive access to affordable housing and safe transportation and food that is nutritious and fortifying, then we are, I wish I could say that would cure Alzheimer's. I don't know if that will cure Alzheimer's, but when Alzheimer's happens, we are better positioned to navigate our quality of life. And so we need families to talk about, what is it I have that's working well for me? I have to say that as a social worker, as well as here's what I don't have, what I need, and what would make my life better. And we need to tell it to our social workers, our physicians, and our elected officials.
Absolutely. Love that, Kelly. Thank you so much for your insights. I want to get to Sarah here. So you're an expert in clinical research. A lot of people, excuse me, in Black and Brown communities, they might not have heard too much about clinical research or not know much about clinical trials, or maybe even their doctor might not have even told them about clinical trials. But I do want to know from you, like, what do clinical trials for Alzheimer's look like today?
Mm-hmm. Well, thanks, Taylor. I just want to say thanks so much for being here. It's such an honor to be a part of this awesome panel and to hear from all of these experts. So I'm Sarah, and I work at USC, and I've worked in Alzheimer's clinical trials for 20 years. And we're at a really exciting time right now in Alzheimer's disease research and care. I would say that we are in a place where we were with cancer 20 years ago. I don't know if y'all remember 20 years ago, if you said cancer, everyone was scared of it. Nobody wanted to talk about it. Nobody would talk about getting care. There was no hope if you had the big C. And that's what Alzheimer's has been right now. And I think that's what feeds a lot of the stigma that's happening in our communities, where people don't want to talk about when they're experiencing memory issues, or their families don't want to share it with other families. As Letitia shared, she had friends that were going through this and they weren't talking about it. Mm-hmm. And I think that stigma is really driven again by fear, because we didn't have hope. Well, we have hope now with Alzheimer's. We now have 2 drugs that have been approved that are actually proven to show that we can slow the disease down. So the impact is really moderate. It slows the disease by 30%, and it doesn't seem to work as great for everyone. So we're at very early stages of understanding what these treatments can do, but there's a lot of other treatments that are underway right now that are being tested in clinical trials. So the hope is there. And the other big thing that happened just within the last few months is we had the first blood test approved to confirm a diagnosis of Alzheimer's disease. Mm-hmm. Now, 20 years ago, you couldn't even diagnose Alzheimer's disease until someone passed away, and a doctor could look at the brain tissue and say, yeah, that was Alzheimer's disease. We were able then to develop better tests, but it takes a specialist to do special memory tests and PET scans to look for amyloid in the brain. Now we have a blood test that can confirm if you're having memory problems, whether those memory problems are due to Alzheimer's disease. And, I love the question you asked, Marcia, about healthcare. What we hear from our patients and families, they're still experiencing discrimination in healthcare. It's not just Tuskegee. It wasn't just Henrietta Lacks. There's everyday discrimination happening in healthcare, which is, of course, impacting Black and Brown communities and their ability to access the best quality care. And it also makes people not want to go into medical research, because why would you trust somebody to give you an experimental medication if you can't even trust them to give you a good diagnosis in the first place? So we do have to absolutely fix healthcare, and researchers and the medical field really needs to take ownership for that and responsibility for fixing that. But in the meantime, we need people to join trials, because otherwise the only answers we're going to come up with are answers that are based on one small segment of the population, and that isn't everybody. And so the best research is going to be research that's informed by a broad set of everybody from all lived experience.
Yes, and actually that brings me to my next question. There's been lately so much talk and debate around diversity in clinical trials. And so I want to hear from you, like, how does including more diverse participants in clinical trials help doctors treat Alzheimer's more effectively for everyone in the population?
Right. Well, research can inform care, right? So I've been working in research for 20 years. My first boss 20 years ago told me we were going to have a blood test for Alzheimer's. I was so excited. I thought it was going to happen within 5 years. It took 20 years. And it does. It sometimes it takes a long time with research. But when you have something like a blood test, especially if you've had really diverse groups of people involved in the research that produces that blood test, you've validated that blood test for everyone. Now that's a tool that any doctor can use to confirm a diagnosis, which makes healthcare more equitable because now more people can access a good diagnosis and you don't have to rely on specialty care that not everybody could access before. So that's just one example of how research can bring in that more equitable access. Yeah.
Right. And there are people who, are interested in clinical trials. They've heard about them. They might want to participate, but they don't know where to start, who to ask. How can someone find and safely join a clinical trial?
Well, I think what we've heard from so one of my favorite parts of my job is I work with our participant advisory board, and they tell us okay, scientists, this is how you need to talk about science so that people aren't completely freaked out when they hear the term clinical trial. Because most people have a pretty strong reaction when you hear the word clinical trial.
Yeah.
I think what I would say if I was just talking, if you were thinking about taking part in a clinical trial, the first thing I would tell you is that you have options and you have all of the control. So you can decide what kind of study you want to be a part of, how involved you want that study to be. If you just want to answer a few surveys, if you're willing to do a blood test, all the way up to, I'd love to have some brain scans, answer memory tests, go to the clinic for hours and hours, and even consider taking an experimental medication. So different people have different, levels of risk that they're willing to take. And what I tell people is I just recommend that they go and look at a website like alzheimers.gov. There's a place where you can hear from people who've been in clinical trials, hear their stories, and then you can look up different options for you. And I think the other thing I would tell you is that, one size doesn't fit all. And definitely, if you're interested in clinical trials, talk to the research team and build that relationship with them. Make sure you're comfortable first before you make any decision about being a part of a study.
Excellent. And, you touched on this a little bit, just a bit earlier, about that medical mistrust that some communities feel towards research. How do we, and I know this isn't something that we're going to solve overnight. I mean, this is something that, researchers have been, working on for years, but how do we tackle the mistrust that some communities feel towards medical research?
Well, I'm a white researcher, so I can't really answer that question. But what I can tell you I do is I talk to people in communities. I ask them, what is it they want from research? What problems are they experiencing in their life where research can come in and help solve those problems? Because that's really why we're here, right? We're here to make everyone's lives better. We want to help improve your life. We want to bring more health equity. So the answer really should come from our communities.
Mm-hmm. Perfect.
Can I add to that? Since I've been a part of the research center at the University of Kansas, I've participated in 2 studies myself as a participant rather than as a clinician or as a professional or a staff person. And it's really been fascinating in terms of helping me understand how the research process works. So then I can be telling the truth when I go out and make a presentation, trying to convince somebody else to do the study. I can say, not only am I a staff person, I'm a client too. And it's okay for me to disclose my participation, although I do feel like I should say participation is always confidential. We are not going out telling anybody what we learned about someone in particular. But anyway, I participated in 2 studies. Both of them have been about what midlife looks like in a healthy brain, and one in particular about menopause and cognition, which, my goodness, am I the perfect test study for this? And what has really been fascinating for me about that, especially in the part where they do some cognition tests and they ask me to remember things and to spell words and to draw pictures and do math problems. And here I am thinking, oh, I'm going to be so good at that. And then it was harder than I thought it would be. And it made me feel so much respect and gratitude to the people I turn around and then say, will you please come and give your whole day and do this with us? And so I think clinicians should take a page out of that book. Clinicians should do their own research so they know what they're asking people to do. And I think that would go a long way. And another question that our research team really likes to ask is, what would make it easier for you to participate? What is it that you want? Because we might think, oh, we'll order a bunch of, pens and tote bags, but really people want gas cards and gift certificates. So if we can make the research relatable to people, if we can remind them that there is some compensation as appropriate and as is ethical, but also the great gift of knowing you are giving this contribution to help people all around the world. I mean, there's just nothing like that. And what works in some communities won't work in others. And that's where we have to be really creative and really thoughtful and sit back and listen to the people that we are hoping to join us in our work together.
Excellent insights, Kelly. And thank you to all of our panelists. Before we wrap up, I just have a couple of questions for the group. And I want to know, how can community leaders, churches, or even local businesses get involved in supporting families that are dealing with Alzheimer's?
I can start it off, I guess. I think first and foremost, I love the question because this is now moving the needle forward, right? How do we do this? I think it has to start by exactly what, Sarah and Kelly were just saying, meeting them where they're at, listening. We have to ask them. We're so accustomed to to kind of saying, this is the clinical trial that we have, or this is the medication that we have, or this is what we've got, as opposed to saying, what do you need? What is it that you're feeling like you need the most right now? Because that's also not going to be what you need today. It's not what you're going to need tomorrow. And what we all need is going to vary, right? Culturally and for each and every one of us. Care is going to be different on how we provide it and how we receive it for our family members. So I think listening is really, really a big thing, by understanding, what is it that we need to do when it comes to how do we move that needle forward. Let's understand first what it is that they need. But also, and I think the panel will definitely jump in on this. I think part of what, I think maybe Kelly, you might have mentioned that it's really just talking to like elected officials, but, talking about like celebrities. There's so many of us that are just like out there, whatever, listening or, watching our favorite, handle on Instagram or whatever. And, there's a lot of celebrities that are out there now speaking about it, they're talking about it. People like the family of Bruce Willis, Wendy Williams, Tony Bennett. These are people that are talking about it. They're bringing attention to it so that now it becomes something that is more normalized amongst us. But again, it's also asking those people, you've got the stage and you've got maybe the funds.
Yeah.
Where can we have that, be brought? Obviously, churches, senior centers, but faith-based leaders.
I would just add to that every church, every organization every business has caregivers or may have people that have been diagnosed as part of that community. So one way to get rid of that stigma is to just talk about these things and create space for those caregivers to connect and be supported. When I was a new mom, our church brought meals to my house for 5 days in a row. I did not have to think about what I was feeding my family. It was such a blessing. I didn't have to ask for the help. And how awesome would that be if somebody could just show up at Letitia's store? Because I have a feeling Letitia's not going to ask for help.
Mhm.
But if I brought her some food, she's going to say no. So I think there's a lot that we can do within our communities to help get rid of the stigma and remind each other that there is hope and that if we all work together, we will find better treatments for this disease.
Wonderful.
One
And-
thing I heard so often in my career was someone who a loved one in their family was diagnosed with Alzheimer's or another dementia. And eventually they found their way to a group like the Alzheimer's Association or one of the Alzheimer's Disease Research Centers. And they said so often, I wish I had known about this sooner. And I feel like we're such a secret. And I think, oh my goodness, I'm working so hard. How is it that nobody knows that there is something like an Alzheimer's Disease Research Center or an Alzheimer's Association? So here's a shameless plug. There are more than 35 Alzheimer's Disease Research Centers in the United States.
Yeah.
So the odds that you have one close-ish to you are probably good. There are more in some places than others, but there are our reach is pretty good. And I can speak from my own research center when I say we have studies and resources that are available whether you live in Kansas or Missouri or Hawaii or New York. We have resources that are available for everywhere. And I think that that's probably true for all of the research centers and for all of the Alzheimer's Association chapters across the country. And Google is a thing, or search engines are a thing. Social workers are real. We have these long lists of resources that we are happy to share. So when you're out there thinking, what do I do? Where do I go? Ask. Know that there's something available, and there are lots and lots of resources available, and we would be so happy to get out there and help.
Wonderful. Thank you.
Yeah, I agree. If I can just, if I can add one other piece to this this puzzle, in terms of when we were saying, meet them where they're at. If there's anyone out there who belongs to a church, and if you're, as I say, you're suffering in silence because you're not speaking up, you're not sharing your story, you're not sharing it, with your faith, community. I would encourage you to actually go straight to your pastor and let them know what's going on. And if they don't have any type of outreach towards caregivers, maybe you're that one person to actually bring it to the church. Maybe you're that voice that everyone else within that church who may be like you needs to actually, be that catalyst to say, hey, let's bring in the Alzheimer's Association. Let's have a workshop. Let's talk about it. Let's have that roundtable discussion. Let's bring someone in, from a center of excellence and really get more into this. Let's talk about clinical trials. I'm involved in the trial. It's on caregiver stress. So sometimes it just takes that one person to bring that idea to the bishop, to the teacher. And I would also say too, another place where we need to look and not forget are the young people who are caregivers. I often say within Black and Brown communities, this caregiving thing, we're trained to do it. So you don't look at it as a job. You don't even realize that you're a caregiver until someone points it out to you. It's just something that you've been expected to do, you've been trained to do, and you just do it. And so there are a lot of young people who are, in this space and doing the work, and they don't realize that there are caregivers and they need that support also in terms of understanding more about this disease, understanding what it means to be a caregiver, knowing where those particular resources, are located. So as we're going out there to the churches and to, into the employment community, which I believe we need a heavy presence within the employer community, we can't forget about the schools. Connect with those social workers in those schools and say, hey, can I just talk about it? Because I guarantee someone's living with grandma who couldn't find her keys. And giving them that space in which to voice their concerns and to voice their fears and to gain that education so that they will be a more empowered caregiver.
Thank you for that, Letitia. And I have just one more question. This is such a good discussion, but we only have time for one more question, and which is speaking to culturally relevant support networks for caregivers. So it just seems like so much information that's readily available about Alzheimer's isn't particularly targeted to one or two demographics, especially those demographics that are disproportionately affected by the disease. So how can we build more of those materials, more of those culturally relevant support networks for caregivers in these Black and Brown communities that are affected by the disease?
I'll tell you about something that we did in Kansas City. It's hard for me to believe, but 20 years ago, and it's still going, which is both wonderful that it still exists and also frustrating because I thought we would have the cure for Alzheimer's disease by now. But 20 years ago, we started a support group for Black caregivers of people with dementia in Kansas City's urban core. And we knew that we could not call it a support group because we knew that people were going to say, I'm not going to go over to Prairie Village, Kansas, which is a suburb in the Kansas City metro. I'm not going to go sit in a circle in Prairie Village, Kansas and tell all my business in front of a bunch of strangers. And so what we did instead was we set up at a church in the urban core and we called our group the Breakfast Club. And we had a hot breakfast. And I don't mean just like donuts and coffee. I mean, we had bacon and eggs and biscuits and grits and coffee. And we said, just come have breakfast with us. Just come sit and visit with us. Whatever you want to talk about is okay. And that was 20 years ago. And that group is still meeting today. Unfortunately, because of the pandemic, we had to shift onto Zoom. But then that allowed more people to join because then people didn't have to leave home and didn't have to find respite care. And they could make their own breakfast at home, which was maybe not quite as exciting. But it started with thinking about, what do people need? What do they want? And they want to feel somewhere like there's somewhere that's safe and welcoming and comfortable that matches their lived experience. And I will disclose that the idea for our Breakfast Club actually came from a group of farmers in Southeast Kansas who also were not interested in going and sit in a circle and talk about their problems, but they would meet at the diner in town and sit along the counter and look forward and look at each other, but they'd face forward and drink their coffee and talk about how their wife burnt the toast and what did that mean. And it worked on these farmers in Southeast Kansas and it worked on these Black people in the urban core in Kansas City. And that was, I don't even know if we used the phrasing culturally competent then, but that was our way of saying, how can we meet people where they are with what it is that they need? So we never trademarked or copyrighted that idea. So if anybody's watching that and thinking I should try that, you have my blessing to give it a try. And then expand it to other communities. I'm sure Marcia could tell us about a Colombian tradition, right? That might work. And I'm sure in the Bronx, Letitia, there's probably all sorts of New York special things that you could do. And I'm from California like Sarah, so I know the Californians can do it. But the point is meet people where they are with what they need.
There's so much to that, Kelly, because I think that one of the things that I think of always is obviously food. Food is what we gather around, right? Our Sunday dinners or our music, just our cultural events. And with cultural events also comes that cultural competence and how do we address somebody that has maybe some kind of memory issues with still being respectful. Touch is such an important thing for Latinos, but it may not be for other cultures, and how we can approach some of these differences and similarities. So I love what you just mentioned. Yeah.
Great. Thank you so much. Thank you so much for that. Again, thank you to our panelists. This has been a really great discussion. Your insights are so powerful. And what we've heard it makes it clear that barriers to Alzheimer's care isn't just a policy failure, it's really a violation of the natural laws or the natural order that our bodies follow. It disrupts timing, lost communication, and really just drains energy from our healing. But we can change that, starting with education, connection, and action. And if you're watching, here are 3 things you can do today. You can visit alzheimers.gov for if you're looking for research centers or different studies on Alzheimer's, and also visit talkaboutalz.org to download free caregiver guides, general Alzheimer's information, and different conversations tools. And speaking of conversation, actually start the conversation. Ask your loved ones if they've noticed any changes in their memory, and encourage them to get screened early. And last but not least, share this video to help raise awareness in your community. Again, thank you to our wonderful panelists, and thank you to our viewers for tuning in. And remember, it's time for a heart-to-heart. Talk to your families. Take care.
Thank you.